At Philips, improving people's health and well-being through meaningful innovation is part of everything that drives us. We believe that sustainability isn't addition to healthcare, but a critical, integral part of its future survival. Our 2030 Sustainable Impact Ambitions programme reflects this commitment, delivering measurable benefits for both people and the planet. Philips is proud once again to sponsor Healthcare Without Harm's European Sustainable Healthcare Awards. These awards celebrate the hard work and commitment being made by individuals and organisations helping to lead to a more sustainable future. The winner of the Sustainable Project of the Year goes to the Great Ormond Street Hospital.
Pill Planet really came from a load of work that we were doing around medicine sustainability, which is obviously key to the trust. But Pill Planet was something which ticked a lot of boxes, both in terms of finance, clinical, and sustainability, and just seemed to be the right thing to do in a children's hospital. Pill Planet became really important because we've always thought that liquids are the thing for children. We know that they like taking lots of different flavoured things, but it's actually liquids that generally taste horrible.
If you look at the NHS, 25% of the carbon footprint actually comes from medicine. So you can imagine that, for a national healthcare system, switching this liquid medicine to tablets is going to make a huge impact.
One parent talked to us about using medicine. They were given a small bottle of medicine, but it comes with so many plastics. It comes with a oral syringe for use, also the bungs, the caps, the spoon, and also excessive packaging. And she asked us the question, do we need all those?
So the biggest environmental gain comes from the logistics. So if we look at transportation, liquid medicines are often bigger in size and are often bulky as well, which means that when they are being transported either on ships or planes or on trucks, they consume a lot more fuel to transport them around.
In our kits, we have a game of Hungry Hippos, which not only will aid sort of building that relationship with the child, but also obviously opens up the conversation about swallowing, taking tablets in a sort of fun and age-appropriate way.
Instead of having a one-size-fits-all framework, our framework is flexible and really focuses on troubleshooting methods that can help children be successful as they're learning to swallow tablets.
We had a mother saying, I am trying to, change my child to a tablet for so many years. You don't know how much different things I tried and did. And now in 1 to 3 sessions, you can actually train my child how to swallow a tablet. That's going to be an amazing difference for us. We can go on a holiday. I didn't actually realize it was going to make this kind of impact this fast because it's so obvious. This is a life skill, but the project sort of exploded while we were even making it.
From the work that we've done, forgetting the actual active ingredients, but every other aspect, all the other bits that make up giving a liquid versus giving a tablet, there's probably about 100-fold difference in the carbon footprint. And therefore, from a sustainability point of view, hugely important that we ship children over as soon as we can.
Liquid medicines often have a short shelf life. What this means is that when a short course is needed, there is a lot of leftover which needs to be discarded. Comparing that to tablets, tablets often have a longer shelf life, between 3 to 5 years or more, and therefore there is less waste generated from this.
Medicines is a massive part of our sustainability programme at Great Ormond Street, and time again when we speak to our young people, themes of medicines, pharmacy and anaesthetics come up. And when you look at Pill Planet and think tablets, we really see the improvement to sustainability and patient care, so it fits perfectly in with our sustainability journey.
At Great Ormond Street Children's Hospital, we have an ideas platform where people can submit an idea, and we are very fortunate to have a team of innovation officers who got together a long time ago to work on Pill Planet. And then this has then bubbled out and can continue to bubble out into different projects and having a bigger impact across different communities, hospitals, and hopefully the world and beyond, as Pill Planet says.
We're super happy with this. I think as a team, the core people who have been involved from the start are still all very much involved. And of course, we sort of grew our little village of people that all got involved in creating a Pill Planet, making Pill Planet better, but to already get this acknowledgement on a European level for other hospitals, hopefully also to take over what we are creating here at Great Ormond Street. I think we are just like over the moon with this. And yeah, we're very excited and very happy that we are being granted this award. I think we're quite an ambitious group. So we are not aiming small. We called it Pill Planet for a reason. And this is because we need to get this global. It's really, really great that we are one of the leading children hospitals in the world. And it's, you know, exciting to work in such an environment and for children to have access to this type of care. It is not just for us here in one language, not just only in the UK, but basically globally. Because this is Pill Planet, it's for everyone, and the change will have an impact for everybody.
Their leadership and commitment is helping to drive forward a healthcare system that is not only sustainable for both people and planet, but for future generations to come. The winner of the Sustainability Champion of the Year goes to Erlend, Aasheim.
My name is Erlend Aasheim. I'm a medical doctor. I'm a specialist in public health medicine. I'm currently working at the Norwegian Directorate of Health. As a medical doctor, I know that climate change is already harming health. As the health sector, we should work to reduce that harm.
Sustainable healthcare is healthcare for everyone, everywhere they live. And it's sustainable because it's achievable. It takes into consideration the nature, the land we live off.
In 2019, I had recently started in the Directorate. I realized that the climate health nexus did not receive sufficient strategic attention. For me as a medical doctor working in a national governance agency, it's logical to connect the three themes of policy, sustainability and clinical work.
He understood or understand the system. So he started out with a strategy, lining out the need for a dashboard to see emissions from healthcare. And he worked through, and the dashboard is working and it's out there.
The roadmap is filled with 100 practical, concrete actions that healthcare providers can take to drive down their emissions. By being publicly available, the dashboard also helps clinicians and others who work in the healthcare sector find the key emission sources and what they can work on locally to drive down emissions. I think what's inspiring about this work is that it's all a big team effort. What we've seen is that desflurane use in Norway has dropped 99% in the past 5 or 6 years. This has primarily been driven by clinical engagement, but also through the powerful instrument that the dashboard is, which can be used to ask executive leaders, why is your hospital using more desflurane than other hospitals?
Companionship we are dependent on, something we create together as a whole creation, actually.
The students say, well, when you have been discussing with us, we have an open discussion in the classroom. You have really inspired me to think about my professional role as a doctor and how I, as a future healthcare professional, can take responsibility for thinking about climate change, healthcare, and combine the two. As I see it, I think having awards and a recognition for the work you're doing, it helps us to legitimate what we are actually doing here and why climate changes and sustainability has to be part of our educational system. We know that climate change is a vast threat to public health, and this is something we should take seriously. So I think gradually, slowly, his interest for sustainability and education has had a gained greater importance at our faculty.
Erlend har jo mye kunnskap om både helse og også klima og miljø, og hvilke utfordringer det gir for sykehus og helsesektoren generelt. Og det er jo kjempeviktig for å få til endring og oppnå resultater. Så det er nok noe av det som er viktigst med Erlend sin rolle, at han har den kunnskapen.
I was well aware of Erlend's work on the COP26 health program. He's just great. And in 2023, I led the team that traveled to Budapest for the launch of the Ministerial Declaration on Environmental and Health. And Erlend, he was part of the team. And he was very active and constructive and knew everybody and cooperated with everybody. So I was so proud having him in the team.
What for me has been inspiring, and what I have learned a lot from having Erlend as my colleague, is that we could align what is seen as a government policy level and what we do in the classroom when we meet the students.
I Norge så har vi jobbet mye med å redusere våre utslipp fra det vi kaller for scope 1 og 2, men nå er den innsatsen vi må gjøre, det er innenfor scope 3 og alt det forbruket vi har i våre sykehus. Så at vi kunne samarbeide mer internasjonalt om å gå over fra det forbruket vi har av engangsartikler til mer flergangsartikler, og jobbe for å få leverandørene til å bidra i den endringen, så tror jeg det kunne gi ganske store resultater.
All this work has been a team effort, so it is a huge credit to everyone who has been engaged, both in my institution and across the health sector in Norway. For me personally, it is an amazing recognition of the importance of this work. In general, there is great opportunity for the health sector to develop their supply chains so that these become low carbon and more resilient than they are today.
So in order to be a champion in sustainability in healthcare, you need to see the bigger picture. You need to stay firm and go for that bigger goal.
When I entered into medicine, my dream was to be able to look back many years into the future and think, I did something meaningful. This mattered to people. I think many healthcare professionals feel the same way. With sustainable healthcare, we can protect people's health, cut costs, and eliminate emissions. So let's do it together.